Okay, this is glucometer skills. First thing we're going to do is identify the need for obtaining a blood glucose level, whether it's a altered level of consciousness or unresponsive, whatever that need is. Typical for normal parameters on the blood glucose is going to be 80 to 120. And then we need to identify if we have any contraindications for that, which are relatively rare. And any potential complications, if we don't calibrate our glucometers, then we could possibly have an erroneous reading, and then there's also the possibility for a exposure to any blood or something like that that we need to be aware of. And then of course we also want to explain the procedure to the patient of what we're going to be doing to them. And today I'm going to be the patient as well as the EMT doing the skill, so that's why I don't have my gloves on for this one. We want to make sure we have all of our equipment. We got a glucometer here. The test strips are actually inside of this. If we do have a separate deal of test strips, we want to make sure that they are not expired and that they haven't gotten wet or anything like that. We do have some spring-loaded puncture devices, lancets there, and our alcohol swabs. And then you also want to have some 4x4s or something like that, or a Band-Aid once you're done with the procedure. First thing we're going to do is, of course, make sure we have our PPE on, turn on the glucometer, and go ahead and get our test strip ready. Which on this style of glucometer, you just do it just like that, and we have our test strip right there at the end. We're going to go ahead and prep that fingertip with alcohol. Now it is very important that once you prep that fingertip, to keep it clean as well as letting it dry thoroughly before you lance the skin. Otherwise it will give you an error on your glucometer. Go ahead and take that off. Now our fingertip is pretty close to being dry. Go ahead and give that a few more seconds just to dry up real well. It looks pretty dry there. Alright, we'll go ahead and lance that fingertip, letting the patient know what's happening. Go ahead and dispose of that in a sharps container. Get our drop of blood there and put it on the tip of our test strip. And then once we do that, we want to go ahead and apply pressure and dress that site. We can use 4x4s, whatever we need to do to go ahead and dress that and apply pressure so we do stop the bleeding. We'll go ahead and record the reading, let the patient know of what it is, and then record it into our paperwork. And then make sure that we didn't have any adverse effects with the patient on that procedure. And then dispose of our sharps or our test strip in a sharps container as well.